Hi everybody.
Hi.
It's Sash and Priti, and we wanted to send you a special message from us at BC Laser, including all the staff. Hope you guys are all keeping well. We're not going to tell you how to wash your hands. We're not going to tell you how to social distance. We're not going to tell you to self-isolate, because you should know all these things by now. What we are going to tell you is things that Sash and I have been doing to stay healthy and well. And one of the things that we've done is try to have a routine of getting up in the morning, saying goodbye to our kids for doing their schoolwork, and saying see you later, I'll pick you up later, even though they're still in the house. Dr. Shah, Sash, has also still been working at the office, seeing medical patients, talking to them actually more often than not, talking and video chatting with them, and seeing the ones that absolutely need to be seen, all with precautions, and also doing a lot of consultations, right, on the cosmetic side.
Yes, it's been challenging. The first couple of weeks were, I found them quite difficult. It was quite difficult to have a totally different routine, but slowly I have got myself into a routine of making sure that we're pretty strict with our daily routine, so everything stays on time. I think for me anyway, the routine is probably the best way to manage this. However, the uncertainty has been quite difficult as well. That was still quite challenging. I know, talking to patients and talking to friends, everyone is having a bit of a tough time dealing with the uncertainty. You try and enjoy the little things, but still you get a moment to yourself and you think, what the heck, what happened? So it certainly is a very difficult time at the moment, for us, for everyone.
So one of the other things we've been doing besides that to help us is walking every day, or taking half an hour out to do some form of exercise. Also taking half an hour out for each of us separately, spending time reading a book or listening to music, not in each other's hair, as we would tend to do normally. So
have you noticed the t-shirt I'm wearing?
Yeah. He listens, I say. So that's one of the other things that we've been doing. We've been trying to eat healthy, usually earlier than we used to. So having that routine back in your life will help you feel a sense of normal and a sense of control, where everything right now is so uncontrollable and things change day by day. So having those little things in your life, like you'll notice I've put makeup on, or I've done my skincare routine, because that helps me feel a little bit more normal than just letting everything go altogether. So think about what makes you feel normal during a day and how you're coping with that. Also, when we send this out, through our newsletter, there's some hints and tips from a psychologist as well that we've put together to help you guys cope. And this is just a pause. It's a pause. So stop, enjoy if you can. Think about other things that you want to do. Think about things that you've been putting off. You might still put them off, or you might just actually get down and tackle it. And we'll be here. We've been here 20 years. We're still going to be here when this is over, when this is at a lull. And we look forward to seeing everyone again. One of the worst things that for us has been not being able to interact with our patients, our clients, like we normally do on a day-to-day basis. And I think that's one of the toughest things, one of the toughest challenges we have, because we love people and it's what we enjoy.
Absolutely. One of the things that I've been accused of is eating a little too much, especially recently. And so I've suddenly realized that every time there's a moment spare, you think about food, and
Or drink.
or drink, and certainly when I see you guys again, I certainly don't want to look a lot bigger. So therefore, every time I think about food, I try and drink lots of water and think of something else, or go out for a walk. So all my friends have been complaining that they've been eating too much. So
It's a big challenge, isn't
we're
it?
all facing it. And so therefore, it's well worth just thinking about that.
So, but we're all in the same boat. We each have feelings of anxiety and stress and depression, but all of us are feeling it at different times. So all we can say is, give people the time of day, give people a chance to cool off when you think, oh, that person's just being a pain. Everybody handles this differently. So allow yourself the time and space to do that, just for you.
But it's amazing. We were just listening to the Bonnie Henry, the public health physician, and it's amazing. Most people are actually really trying to do their bit. Most people are traveling less. Most people are really trying hard to flatten a curve, and it's amazing. The results are speaking for themselves. So it's great to feel positive about that. We're all in it together.
Yeah, and that's pretty much all we have to say. It is a pause. We will see you again and soon, and keep up with your routines. Those things are what will help you get you through this.
And we will probably post something else in a few days as well.
Thank you.
Bye.